As part of the social care division in the HSE, we have a holistic approach to supporting older people in the services and their communities, and because we are a health service we can't always do that ourselves. So in partnership with ALOME we helped fund 4 support coordinators to pilot a project out here in Dublin North City and County. The aim of the project going forward is that by the end of 2019 we'd like to have this project rolled out nationally around the country so that everybody would have access to support coordination.
What the project has done is made sure that befriending volunteers are available to all older people who need it in the area, and 30% of all the referrals we're getting is older people ringing themselves looking for support. What it means is that coordination of supports, the ability for somebody to come out to your home or work with you from hospital to basically sit down with an older people and say what are the blockages to you ageing at home and what supports do you need, and that means that those staff are available to older people. And on top of that is what it meant for the community is that there's people available that can link all the services together, and also on top of that is that there's technology available to the older people and to their friends and family.
Whenever we go out to somebody, quite often or not we find out that they haven't been to their doctor in the last 5-10 years. They're not linked in with any of the services, and you will find that somebody maybe does need that occupational therapist. They do need a social worker linked in. They do need the public health nurse to be coming to dress a wound that maybe isn't healing properly. So it's about making sure that we're meeting those needs of their physical health as well as their mental health, as well as their mobility, making sure that they can get about their home suitably and safely as well, which is the key.
The success of the programme has been down to the comprehensive communication strategy that was put in place to ensure that our population were aware that this programme exists. There has been over 500 referrals to the programme so far, and referrals have been made from professionals such as GPs, social workers in our hospital system, and even the older person themselves.
As a support coordinator, it's my role to go out into people's homes who've been referred into the service. I complete a full holistic person-centred assessment of their needs, and basically we put in a support plan once we find out what the problems are to try and solve a few of the issues with the older person. So it can be anything from an adaptation or a repair to something in the house. It can be to access funds or a scheme that's in the local area, or if it's social isolation we can make sure that there's a volunteer that's put in place then once a week. We also have events at ALOME, so we make sure that people get to all the events that we have.
Oh, it's a big difference having someone coming to me. You know, just to keep me company, like, you know, and that. It's great to have somebody's face coming in the door to you. You know.